How often should I shower? It sounds like such a simple question, doesn't it? But for many seniors and their caregivers, this everyday routine can become surprisingly complicated. I've seen it happen countless times. Well-meaning family members insisting their elderly loved ones need a daily shower, while seniors push back, feeling their autonomy slipping away over something that used to be so personal and simple. Take Margaret, for instance. At 82, she found herself constantly at odds with her daughter about showering. "Mom, you need to shower every day," her daughter would insist, while Margaret felt perfectly clean showering just twice a week, the way she'd done for years. This tension created unnecessary stress for both of them, all because of a well-intentioned but misguided belief about proper hygiene for seniors. But the truth is, the conventional wisdom about daily showering doesn't apply uniformly to everyone, and for seniors, it can actually cause more harm than good. Aging skin is different, thinner, drier, and more vulnerable. And treating it the same way we treat younger skin can lead to serious problems from rashes and infections to dangerous falls. If you're caring for an aging parent or even approaching your senior years yourself, missing this information could mean unknowingly contributing to skin damage, increased fall risk, and unnecessary conflict over hygiene routines. It could also mean missing important warning signs that a senior's health may need attention. In this video, we're going to talk about 5 critical aspects of senior showering: how aging affects skin and cleansing needs, practical showering frequency recommendations, essential safety considerations, alternatives to full showers, and how to recognize when changes in hygiene habits might signal something more serious. Stay with us until the end, because in the final section, I'll share a surprising insight about hygiene routines that many healthcare professionals don't discuss, but that could dramatically improve both safety and quality of life for the seniors you care about. Let's start with something many people overlook when thinking about senior hygiene. Aging fundamentally changes how skin functions and what it needs. This isn't just about developing wrinkles or age spots. It's about significant structural and functional changes that directly impact cleansing requirements. Many people assume skin is skin, regardless of age. We've been told since childhood that daily showering is necessary for good hygiene, and this one-size-fits-all approach gets applied across the lifespan. But applying younger adult standards to senior skin is like using the care instructions for silk on a delicate antique fabric. It simply doesn't account for important differences. From a scientific perspective, here's what happens. As we age, our skin produces significantly less sebum. That's the natural oil that keeps skin moisturized and protected. The skin's acid mantle, which helps fight off bacteria and infection, becomes less effective. Meanwhile, cell turnover slows dramatically, taking longer to repair damage. Even the fat layer beneath the skin thins out, reducing natural insulation and protection. These changes aren't just cosmetic. They create real consequences for seniors. Physically, overbathing can strip away what little protective oil remains, leading to extreme dryness, itching, cracking, and even eczema flares. Many seniors experience what dermatologists call winter itch year-round because of excessive bathing. And emotionally, the discomfort from overly dry skin can range from mild irritation to genuine distress that affects sleep and quality of life. Here's how these changes typically manifest. First, you might notice increasing dryness and flakiness, especially on the arms and legs. The skin may appear papery or crepey and feel rough to the touch. Seniors might complain of persistent itchiness that gets worse after showering. And in more severe cases, you might see redness, inflammation, or even small cracks in the skin, particularly on the hands, feet, and lower legs. So what should you do with this understanding of aging skin? First, recalibrate your expectations around cleanliness and bathing frequency. For most seniors, 2-3 showers or baths per week is plenty sufficient for good hygiene, with targeted cleansing of critical areas on non-bath days. Second, when bathing does occur, use lukewarm, not hot water and mild, fragrance-free cleansers specifically formulated for sensitive or dry skin. And third, post-bathing moisturization becomes absolutely critical. Apply a rich, fragrance-free moisturizer while the skin is still slightly damp to lock in hydration. Now that we understand how aging changes skin's fundamental needs, let's move on to practical recommendations about shower frequency that balance hygiene, health, and comfort. Now let's address the central question directly. How often should seniors actually shower? The answer isn't one size fits all, but there are clear guidelines that differ significantly from what many people believe. For most healthy, active seniors, bathing 2-3 times per week is typically sufficient for good hygiene. This might sound shockingly infrequent if you've always believed daily showering is necessary, but it's important to distinguish between actual cleanliness needs and cultural norms that have little to do with health. Many people confuse normal body odor variations with uncleanliness or poor hygiene. A slight natural body scent doesn't indicate a health problem or insufficient bathing. In fact, what we've come to expect, completely odorless humans, is more a product of marketing than medical necessity. Our modern obsession with daily showering is relatively recent and driven more by cultural shifts in soap advertising than by actual hygiene requirements. The underlying causes for reduced bathing needs in seniors include lower activity levels leading to less sweating, decreased oil production in the skin, and a naturally lower bacterial load on the skin compared to younger adults. Additionally, the body's microbiome, the healthy bacteria that live on our skin, actually helps protect against harmful organisms, and too frequent washing disrupts this natural protection. This reduced bathing frequency affects daily life positively for many seniors. It can save considerable energy for those with limited stamina, reduce the risk of falls and injuries associated with getting in and out of showers, and significantly improve skin comfort. Many caregivers report less resistance to bathing when it's not an everyday battle, improving relationships and reducing stress for everyone involved. Common misconceptions worth addressing include the belief that daily bathing prevents infection. It can actually increase infection risk by damaging skin, that skipping days is dirty, spot cleaning key areas maintains hygiene, and that body odor always indicates poor hygiene. Moderate natural scent is normal and healthy. Here are practical response strategies. First, establish a regular but reduced bathing schedule, perhaps Monday, Wednesday, and Saturday, to create predictable routine without excess. Second, implement daily sponge baths for key areas, underarms, groin, face, and any skin folds, between shower days. Third, use dry shampoo or alternate hair washing schedules independent of body washing as needed. And fourth, adjust frequency based on individual factors like incontinence, medical conditions, and personal preference while still avoiding excessive bathing. Before we continue to our next critical point about safety, I want to check in with you because you've stayed with me this far. If you're finding this information helpful, especially if it's changing how you think about senior bathing, please take a moment to like this video and leave a comment sharing who you're caring for, whether it's a parent, spouse, relative, or client. Your experiences help others feel less alone in navigating these challenges. And if you haven't subscribed yet, hit that button now because we cover essential caregiving topics like this every week. Now let's talk about something that could literally save a senior's life safety considerations that too many people overlook. The third critical aspect of senior showering that demands our attention is safety. This isn't just an afterthought or a nice to have. It's absolutely essential because the bathroom is statistically one of the most dangerous places in the home for older adults. Safety during bathing is particularly important because many people don't realize just how high the stakes really are. According to the CDC, falls are the leading cause of injury among adults 65 and older, and the bathroom, especially during bathing activities, is where a disproportionate number of these falls occur. A fall for a senior isn't just a momentary setback. It can lead to serious fractures, hospitalization, loss of independence, and even be life-threatening. To understand this technically while keeping it relatable, bathrooms combine multiple high-risk elements: slippery surfaces, hard fixtures, confined spaces, temperature changes that can cause dizziness, and activities that require balance while standing. For seniors who may already have reduced mobility, compromise, debalance, or taking medications that cause dizziness, this creates a perfect storm of fall risk. The emotional dimension here is significant for both seniors and caregivers. For the older adult, fear of falling can lead to bathing anxiety or avoidance, which can impact both hygiene and quality of life. Meanwhile, caregivers often experience constant worry about their loved one's safety, especially if they can't be present during every bath or shower. This concern is completely valid. I've worked with countless families where a bathroom fall was the event that dramatically changed a senior's living situation or independence level. There are certain warning signs that indicate immediate attention to shower safety is needed. Unsteadiness when standing, difficulty stepping over tub edges, reported dizziness during or after bathing, trying to reach for dropped items while showering, or any near-miss incidents or slips. If you observe any of these, Don't wait for a fall to make changes. For long-term management, here are concrete strategies. First, install proper grab bars, not towel racks, near the shower and toilet. These should be professionally mounted to support a person's full weight. Second, use non-slip mats both inside and outside the shower or tub. Third, consider a shower chair and handheld shower head to eliminate the need to stand while bathing. Fourth, ensure the bathroom is well lit with easy access to towels and supplies without reaching or bending. Fifth, maintain a comfortable temperature in the bathroom to prevent dizziness from heat. And lastly, consider updating to a walk-in shower or bath if renovations are possible. The most important safety measure might be having an honest conversation about when independent bathing is no longer safe. This is difficult but necessary, as many seniors won't voluntarily give up this aspect of independence even when it becomes dangerous. Approach this conversation with respect, perhaps involving a healthcare professional, and emphasize that assistance with bathing doesn't mean a complete loss of privacy or dignity. Now, with safety addressed, let's move to our fourth important point: alternatives to full showers that can maintain hygiene while reducing both safety risks and skin damage. Now let's explore something that can be genuinely game-changing for senior care: effective alternatives to full showers that still maintain excellent hygiene. These approaches aren't compromises or less than options. They're often superior solutions for many seniors' needs. While traditional showers are deeply ingrained in our concept of cleanliness, they're not the only or even the best way to maintain hygiene, especially for older adults. This fixation on full-body showering as the gold standard is a relatively modern and culturally specific phenomenon, not a universal requirement for cleanliness. Let me explain the science in everyday terms. Human bodies don't get uniformly dirty. Certain areas, underarms, groin, feet, skin folds, and the face harbor more bacteria and require more frequent cleaning. Other body areas, particularly for less active seniors, simply don't accumulate much dirt or bacteria. Targeted cleaning of high-need areas can maintain hygiene effectively while avoiding unnecessarily stressing fragile skin on cleaner body parts. This approach dramatically affects quality of life for many seniors. It preserves energy for more meaningful activities, reduces physical stress on the body, minimizes fall risk, and decreases skin problems from overbathing. Many seniors and caregivers report that switching to these alternatives reduces bathing resistance and conflicts, making hygiene maintenance less stressful for everyone involved. Here are specific alternatives that work remarkably well. First, sink bathing or bird baths, using a washcloth at the sink to clean face, underarms, and private areas daily. Second, bed baths for those with mobility limitations, using special no-rinse cleansing products. Third, seated shower chair sponge baths, where the senior sits on a chair in the bathroom, not in the tub, while a caregiver helps with targeted washing. Fourth, washcloth and basin bathing at a table, which can be easier than bending over a sink. And fifth, commercial body wipes specifically designed for bathing, which have improved dramatically in recent years. When implementing these approaches, a good rule of thumb is daily cleansing of the face, underarms, groin, and any skin folds, with attention to feet several times weekly. Areas like arms, legs, back, and abdomen typically need full washing just 2-3 times per week for most seniors. It's important to consult professionals about this approach if there are specific medical conditions present. For instance, diabetes may require more careful foot monitoring and cleaning, incontinence necessitates more attention to the perineal area, and certain skin conditions might require specialized cleansing routines. For the many cultures and individuals who find bathing to be not just about cleanliness, but also relaxation or ritual, consider preserving the psychological benefits through adaptations like aromatherapy during sink bathing, playing favorite music during any cleansing routine, or focusing more attention on pleasant after-bath rituals, like applying a favorite lotion, or getting into fresh, comfortable clothes. If you're still with me at this point, thank you for your dedication to learning about this important topic. Would you take a moment to share this video with someone else who's caring for an older adult? This information often goes undiscussed, but can make such a difference in daily care. And if you haven't subscribed yet, please do. We're building a community of informed, compassionate caregivers who share practical wisdom. Now let's move on to our final and perhaps most important point: recognizing when changes in hygiene habits might actually be warning signs of something more serious. This fifth point may be the most crucial of all. Knowing when changes in a senior's bathing habits or hygiene might actually be signaling something more serious that requires attention. Changes in personal hygiene aren't always just about preferences or stubborn habits. They can be important indicators of cognitive decline, depression, physical limitations, or other health issues that need addressing. This is perhaps the most overlooked aspect of senior bathing because we tend to focus on the immediate goal of getting them clean, rather than understanding what their bathing behavior might be telling us. Why is this so often missed? Because changes in hygiene routines happen gradually, and we tend to attribute resistance to bathing as simply a personality quirk or stubbornness. But this interpretation can cause us to miss important warning signs that could help identify health issues in their early, more treatable stages. Let me break down what might be happening below the surface. Cognitively, bathing is a complex executive function that requires planning, sequencing multiple steps, remembering products and their purposes, temperature regulation, and time management. Early dementia often affects these abilities before more obvious memory problems appear. Physically, reluctance to shower might stem from undiagnosed pain, arthritis, mobility issues, or fear of falling that a senior hasn't verbalized. Emotionally, sudden disinterest in personal hygiene is a classic sign of depression, which affects nearly 20% of seniors, but is often missed or dismissed as just aging. How these issues connect with the points we've discussed. The appropriate bathing frequency, point 2, becomes irrelevant if cognitive issues prevent bathing independence. The best safety equipment, point 3, won't help if depression has caused apathy about self-care. And even the most effective bathing alternatives, point 4, may be rejected if there's an underlying issue affecting a senior's ability or willingness to participate in hygiene activities. Here are specific warning signs that hygiene changes might indicate something serious. First, a previously well-groomed person who suddenly seems indifferent to cleanliness. Second, confusion about the bathing process, like using inappropriate products or forgetting steps. Third, new fears about bathing that seem excessive or irrational. Fourth, hiding soiled clothing or denying that bathing is needed when it clearly is. And fifth, physical signs like unexplained bruises that might indicate falls occurring during unassisted bathing attempts. If you notice these signs, appropriate responses include: schedule a comprehensive geriatric assessment with a physician who specializes in senior care, specifically mentioning the hygiene changes you've observed. Consider a cognitive evaluation, particularly if there are other subtle memory or behavior changes. Explore whether depression might be a factor, especially if the changes coincided with a loss or life transition. Arrange for an occupational therapy home evaluation to identify physical barriers to bathing and possible solutions. And finally, initiate gentle, non-accusatory conversations about bathing difficulties, asking open-ended questions like, what parts of taking a shower are hardest for you these days? Addressing these underlying issues, rather than just forcing bathing compliance, often resolves hygiene problems while also addressing more serious health concerns before they progress. Remember, changes in hygiene are rarely just about cleanliness. They're often trying to tell us something important about a senior's overall health and well-being. Now, let's bring all these points together to create a complete picture of senior bathing that respects both health needs and dignity. We've covered a lot of ground together in this discussion about senior showering, so let's recap the 5 essential points we've explored. First, aging significantly changes skin and its cleansing needs, with senior skin requiring less frequent washing and more moisture protection. Second, for most seniors, bathing 2-3 times weekly is medically appropriate, with spot cleaning on other days. Third, bathroom safety is absolutely critical and requires specific modifications to prevent dangerous falls. Fourth, alternatives to full showers can be equally effective and often safer for maintaining good hygiene. And fifth, changes in bathing habits or resistance might signal serious cognitive, physical, or emotional issues that need medical attention. When we understand all these aspects together, we begin to see senior bathing not just as a hygiene task, but as an important component of overall healthcare that requires balance, adaptation, and attention to changing needs. This comprehensive view helps us move beyond struggles over shower frequency to creating sustainable, dignified, and healthy cleansing routines. I know navigating these issues can feel overwhelming, especially when you're trying to balance respect for a senior's independence with genuine concerns about their health and safety. Remember that perfect solutions rarely exist. Instead, aim for reasonable compromises that address the most important health and safety needs while preserving as much autonomy as possible. And be gentle with yourself through this process. Caregiving is challenging work that often lacks clear guidelines. Here are concrete next steps to consider. First, assess current bathing routines in light of what we've discussed, particularly bathing frequency and safety measures. Second, begin a respectful conversation with your senior loved one about their preferences and concerns regarding bathing. Third, implement small changes gradually rather than overhauling everything at once, which can create resistance. Fourth, consider consulting an occupational therapist who specializes in senior care for personalized recommendations. And fifth, remain observant for any changes in bathing behavior that might signal health issues requiring medical attention. I want to leave you with this empowering thought. By adapting bathing routines to meet actual needs rather than adhering to arbitrary standards, you're not lowering your standards of care. You're actually providing more informed, appropriate care that respects both the body's needs and the person's dignity. That's not compromise, it's enlightened caregiving. If you found value in this discussion, please help others access this information by liking, subscribing, and sharing this video with anyone caring for an aging loved one. I'd also love to hear in the comments about your experiences with this topic. What approaches have worked in your caregiving journey? What challenges are you still facing? Your contributions help build our community of knowledge. In upcoming videos, we'll explore related topics including adaptive equipment that can make bathing easier, approaches to resistant bathing behaviors, and how to handle hygiene for seniors with dementia. Subscribe so you don't miss these important discussions that continue to support you in your caregiving journey. Thank you for your commitment to compassionate, informed senior care.